Hi, everyone. Yeah, we are the DocChain team. We are doing health prior authorization using blockchain. So this is our team: Alex, Serene, Gayatri, myself, Katie, and Neil. We are the team that did this, and we have our mentors Florence, Gabriel, and Alex, who is not here at the moment today. So so let's dive into it. So what is prior authorization before we go into what our project is? When a doctor wants to prescribe a patient some medication which is not covered by their insurance plan, they need to approach the insurance personnel to authorize the prescription before they do it. And insurance does this to ensure that the patient gets the clinical guidelines approved prescription and not something additional tests or anything to do that.
So what is the issue with this current process? Well, from the medical perspective, a doctor really wants to prescribe a medication or a procedure for their patients as soon as possible, and they're finding that they have a really long wait time, which could lead to abandonment of treatment. For the nurse that is helping the doctor out, they're spending a lot of time communicating with the insurance company or putting these together instead of treating patients. And then on the insurance side, they're also having a lot of issues because they need to spend a lot of time tracking down paperwork, which they didn't get from the medical side because there were so many different kinds of, there were lots of different application processes for different insurance companies, so it was very difficult for them to figure out exactly what to submit.
So this is the flow of the PA process as it is right now. And in red, we've identified some pain points in the life cycle of a PA request. So obviously, it starts when a physician prescribes something that requires PA. And immediately, we hit this issue of just submitting the request because each insurance company and potentially each medication has its own form that needs to be submitted. And then right after that, we have to wait for a response from the insurance, and that's a big problem because that can take an unpredictable amount of time, and there's no way of knowing of how far along the request is on the insurance side. And then when we finally do get a response from the insurance, it could be that the insurance says that the submitted information actually wasn't sufficient to come to a decision, and they request more information. So the medical assistant goes back into this loop of having to resubmit the request and wait for yet another response before finally getting a decision for the physician and the patient.
So we interviewed a medical director of a Medicare Medicaid health plan, and what's great about him was that he was also a physician for 17 years before switching into his current role, so he was able to offer an insight from both sides. And what we found is that the biggest pain point for the medical side is just that it's what I said before about like how there's so many different systems out there that they really don't know what to submit. And then on the so this is all stuff that happens in between, you know, when they submit something and before the insurance side is even looking at the paperwork to determine what is the right use. And on their side, like I said, it's really difficult for them to track down all the necessary paperwork. And with that, we came up with these two hills for a medical assistant a medical assistant can ensure that all required documents for APA are sent on the first try every time. And for the insurance administrative assistant, that they can receive all required documents to make a decision on a PA without ever having to spend time on requesting it.
So with those hills to guide us, this is the new flow in the process that we envision it to be with the introduction of our solution, DocChain. Again, it starts when a physician prescribes something that requires PA, And the medical assistant, again, compiles the data and submits this request, but now they're submitting it to this centralized source, which is us. And then we kind of verify the request and provide immediate feedback for if it has all the information required so that they don't have to go through waiting for if they need more information before they finally completely submit it. And again, this whole process of waiting for a response, we also address. Go over now.
So here's the value that we're looking to get from this project. First, we're hoping that this leads to faster patient care. The less time we spend waiting on responses, the more likely patients will get treated faster, less likely they also are to get more sick. Nurses will be able to spend more time with patients, which is, what the reason they became nurses. They didn't become nurses to deal with prior authorization requests all the time. So we're going to look to create a central location for all prior authorization requests and save time in medical personnel looking at different procedures for different companies. Also, on the insurance side, we hope that this will dramatically decrease the amount of times a insurance personnel will have to say, hey, I'm missing this form. We're hoping that DocChain will get rid of that completely. And from the business side of things, it turns out from a survey created in 2017 that the average amount of time spent on prior authorization requests per physician, this is their entire staff, not just a physician, is about 14.6 hours per week. If you do the math out with nurses making about $30 an hour, that's $1,752 a month per physician. Imagine a hospital that is just filled with, probably over like 50 doctors. That could be, a ton of money. As well as this creates an immutable history of all transactions that have occurred. So every single request and response has been recorded over time.
Okay, so our solution, DocChain, based on these pain points that we've identified, we propose to be built on the blockchain network, where each hospital or insurance company can be a member or peer. Some of the benefits of this is using the Hyperledger. It already provides a level of encryption, and additional measures can be taken based on the company using it. And as Alex mentioned, this would provide a centralized platform for all of these requests, as well as it provides data authenticity, and any transaction taken in response to any of the requests, there's going to be an immutable history on this, so everyone is able to view this. And then additionally, we propose integrating existing Watson Health services to our system, including Gemstone, which would be able to provide analytics and statistics based on the patient that they're looking at, and similar patients with that condition or risk factors that they have, and kind of the success or effectiveness of the medication or procedure being requested. And this is a really brief, so say we have like the application interface, any of these requests, all these transactions are going to update the state of our blockchain and add those transactions to the history. You can go on. And so this, just to highlight some of these, we have the hospitals acting as peers in our network, insurance company, probably a system admin, and then this is where we see the Watson Health integration could be beneficial to the insurance agents.
So with that, we kind of designed a few wireframes, and I'll just go through just a sample scenario of how the medical assistant submit the form and how the insurance is going to respond to the request. So the medical assistants can see a list of all the prior authorization requests they made. They go, so initially there's a template selector, which kind of helps them get all the things like in place, and then once they select all the medication and stuff, they go to the actual form where some of the data is auto-populated, and once they submit it, it goes to the insurance side, and once the insurance can respond with an accept, deny, or any other response they want to.
So we put a little bit of thought into how we would price this thing as well as where our revenue would come from. To set up an enterprise blockchain network, it costs $1,000 per month for every peer on the network and $1,000 per month for every membership on the network. On top of that, our costs would also include our employee salaries. Based off of that, we would offer several different subscription levels, and those levels include, optional peer, optional membership, maybe neither. We're thinking about clinics that are much smaller that don't have a lot of resources, as well as the ability to add more user licenses for higher pricing.
So I know we're running out of the time, and just a slide on our team and what we learned, Agile and design thinking. We learned a lot about that on Hyperledger Fabric, and that's it from us.